Facial palsy affects 100,000 people in the UK and it can have devastating impact on their lives.
And now a new study suggests the condition isn't being taken seriously enough by the medical profession, with many sufferers simply told to go home by GPs.
I'm pleased to welcome Selma Abbey, who's fallen ill, or did fall ill, with Bell's palsy when she was 36 weeks pregnant, and Dominic Bray, a plastic surgeon who specialises in facial paralysis. Sean and I were saying, Selma, we both have family members who've suffered from Bell's palsy, and what is shocking about it is just how sudden it comes on without any warning at all.
It really does indeed. I was, as you say, 36 weeks gone. I woke up that morning with like quite an intense ringing in my left ear. Just, you know, being so heavily pregnant and I didn't want to take any chances, and I had a bit of tenderness in the jawline anyway. Yeah, so I went to the GP. They just said, you know, there's no sign of any ear infection or anything like that, so just kind of go home, keep an eye on it. And then, yeah, that evening, my face just really suddenly slumped, just all down one side, which was obviously quite shocking and, you know, panicked us a little bit. So we went to the hospital and, yeah, very quickly after the diagnosis, actually, they just sent us home. There was no leaflet, no follow-up appointment given, nothing at all.
Dominic, is Selma's story quite common then, that there's this misunderstanding by GPs about Bell's palsy? Because surely if you get something it should be treated early, shouldn't it?
I think that's absolutely right. It's not just the GPs, it's everybody. There's a huge misunderstanding about facial paralysis in general. In Selma's experience, she didn't get treatment quick enough. There's a lot of evidence that suggests if you get treatment quickly, the outcomes are better and better more quickly. And really what we're doing this week is raising awareness about facial paralysis and its effects, not just functional but also psychological and social effects of facial palsy, which does touch a lot of people.
Well, quite. I mean, the psychological impact is huge, isn't it? I mean, one day you're a beautiful looking woman and then suddenly, and then you have this thing where you have to go out and face the world with this disability, really, that is there for everyone to see. So how do you deal with that? What was it like for you?
It was tough. I mean, I think what coincided with that was the fact that I was pregnant, not just pregnant with twins, where, you know, it attracts a lot of attention anyway from your friends and family. They're all really concerned and want to make sure you're okay. So yeah, people kind of flock to the house as soon as they hear what's happened, which is really nice. But you don't really want to always face everyone. You don't want to make eye contact with anybody. You don't want to go out and get your shop from the supermarket. You just want to kind of hide for a little while, and it's not really easy to do that.
Just looking at the before and after here of, I mean, to be honest, it's only because you're here talking about Bell's palsy that I'd even noticed you've come so far, I suppose. Is that from surgery or is it from help? How have you got back to where you are now?
Yeah, people do say that, which is quite kind of, you're not sure if people are being polite or not.
No,
but,
I really mean that.
Yeah, people do say it quite a bit. There's no surgery for me. I don't qualify for surgery, unfortunately. Mine is only a temporary injury, which means the nerve is regenerating very slowly, but it's just very uncoordinated. I'm never gonna go back to normal, put it that way. My treatment consists of Botox therapy and physiotherapy as well.
Well, Dominic, you've got half a beard, haven't you, today?
Yes, I have, yeah.
To highlight really this issue. I mean, people will want to know what causes it.
Facial paralysis is caused, there are over 30 different causes of facial paralysis. Most people associate it with Bell's palsy. And that is the most common cause, but really facial paralysis is caused by an injury to the facial nerve. The facial nerve runs from the brain through to the muscles of the face, so any disorder along that pathway can cause an injury.
And what can that be, through stress? Or
it can either be due to infection, it can be due to brain injury, it can be due to bone injury within the skull, ear disorders, or trauma or cancer in the face.
But when you say it's a virus, isn't it? And we don't know how it gets in there.
Bell's palsy is thought to be caused by a virus, and that's why early treatment is very, very important. Treatment with steroids within the first 72 hours and antivirals, if there's signs of viral infection, really does improve outcomes. And getting that message across to people to get early treatment and access to the right specialists as quick as they can will provide the best outcome.
In fairness, sorry, I was given the steroids.
Right. I just wondered, because it looks like, or it could be misinterpreted as a stroke, and I wonder if that's why doctors are slow onto it, or they say, oh, don't worry, it's not a stroke, and therefore they ignore actually just how serious it is.
I think that's right. I think we as doctors focus on curing disease. Facial paralysis isn't a disease, it's a condition. It's a symptom of an underlying problem. If we can cure that problem but not actually focus on the after effect, the psychological, the social and the functional effects, then I think we as doctors are failing in that regard.
And Selma, as someone who's been through it, going through it, what would your advice be to other people?
To other mums to be, you know, recent mums, the best thing they can do is get a referral from their GP immediately, as soon as they can, to the right place. You know, I'm under the care of Queen Victoria Hospital in East Grinstead. There are other clinics and health centres around the country, but I mean, they're specialists there, and they can help you. They can give you a tailored physio programme that is just for you, and it targets the problem areas in your face, if you like. That's the first thing you should do, just act quickly.
And to be aware of it. So thanks both for coming in and talking about it to us today. Thank you.
Thank you.
Yeah, we're very grateful. Thanks for coming. Thank you, John. Facial palsy affects 100,000 people in the UK, and it can have devastating impact on their lives.
Yes, now a new study suggests the condition isn't being taken seriously enough by the medical profession, with many sufferers simply told to go home by GPs.
Well, let's speak to Selma Abbey, who fell ill with Bell's palsy when she was 36 weeks pregnant, and Dominic Bray, a plastic surgeon who specialises in facial paralysis. Selma, Dominic, thank you for coming in. Let's talk about your story, Selma, first of all. When did you first notice that something was wrong?
As you say, 36 weeks in, I had a loud ringing in my ear, in the left ear. When I woke up one morning, it was quite intense. And some tenderness along the jawline. So I went to my GP, just, you know, not to take any chances. And he checked for signs of an ear infection, which there were none. And he said, you know, just keep an eye on it. Any problems, come back. But yeah, there wasn't really much time to. By that evening, I was struggling to eat properly. My mouth just felt like it wouldn't close. And then I looked up and realised that my whole face on the left side had just slumped.
So you didn't notice till you looked in the mirror?
Not really, no. I mean, I felt something was a bit strange. I felt kind of like I'd had an injection from the dentist, like that kind of droopy, nummy sensation. But yeah, it was only when I looked that it was like, wow, a real shock.
And what did just at that moment? What did you think? Did you think it was? Did you know it was Bell's palsy?
No, I'd never heard of Bell's palsy. Never heard of it before.
So did you think it was a stroke?
Immediately, yeah. I didn't know if I was going to die. Like, it was quite dramatic, really. It was a shock. You know, I thought it was a stroke, and we needed to get to the hospital immediately.
And Dominic, that's the point, isn't it? Not many people are aware of facial paralysis, of Bell's palsy either. I know that you've got, you've shaved half your face. I don't know if we can see that if you turn to the camera. You've shaved half your face, got a beard on the other,
yes,
because you want to make people aware of this point, really.
I do. I mean, it's a fairly paltry attempt, but but yes, I'm wearing half a beard this week because it's the Facial Paralysis Awareness Week, which is arranged by the charity Facial Palsy UK, which is a charity set up for patients with facial paralysis to inform, support and research into facial palsy. And across the world, I think the first half beard was shaved in Australia. It'll be yesterday now. A father of a little boy, the father's called Adam, son was born with facial paralysis. So just in support of having one side of the face looking different to the other, men are shaving half their faces, ladies are wearing half makeup.
Yeah,
does it frustrate you as a doctor, though, that so many don't see it as a serious thing, or serious enough to refer a patient to a specialist unit?
Yes, it's very, very frustrating. There's a small contingent of us, globally really, who are specialising within this area. Because facial paralysis is a condition and not a disease, it isn't really given the time, the resources or the funds to look after people. And it's not just about looking different. You know, there's huge psychological and social implications as well as functional implications from facial paralysis.
Selma, how did it affect you? Obviously, you said there was that initial shock.
Yeah, there was. I mean, there was a relief initially once I found out it wasn't anything life-threatening. The babies were fine, and I was going to be okay. Yeah, it did affect me emotionally in lots of ways. I think the real low point was probably about 6 months on. The hospital told me I would be fine in 2 weeks. And, you know, you try to stay positive. You've obviously got a lot going on as well, waiting for the babies to arrive. That's quite, you know, it's an anxious time. 6 months on, you realise this is not right. Something is clearly wrong. I need to go and seek more help, different opinions, and I just wasn't getting anywhere. It took 6 months to finally be referred. It took 9 months to be referred to a neurologist, which it's just too long.
We don't really know what causes it, do we? Particularly Bell's palsy. I've read that they think it's a virus that gets into the ear canal or something, but there's no idea where it comes from, nor indeed how to cure it.
Yes, that's very true. There's conflicting evidence, really. There's somewhat evidence that would suggest that it is a virus that causes Bell's palsy, and certainly having had experience myself of facial paralysis, not only as a doctor but as a patient, personally I would take antivirals as well as steroids very quickly within 72 hours of onset.
Right. That's good advice. You would, sorry, just say that again. So you would take antiviral drugs as well as...
I think that the main things to think about are firstly, seeking help.
Yeah.
So going to your GP, your primary medical provider, to get a prescription for steroids and maybe antivirals. You need to protect the eye. If you're unable to close the eye, very quickly we can develop problems with the eyes, abrasions, scratching, scarring on the eyeball. So taping the eye down at night, wearing glasses outside in the wind. Occasionally you'll need to support the lower lip to drink. And then really it's about having information and access to specialist expertise to help you through, because later on there may be further outcomes from the facial paralysis that need treatments, not necessarily surgery.
And Selma, just briefly, advice then to somebody else who might find themselves with this condition.
Particularly new mums, obviously that's where my experience lies. I would really just encourage ladies to get to their GP sooner rather than later. Don't wait. You know, if the time period that they've given you, 3-4 weeks, if nothing's changing, you need to act quickly and be referred to the right specialist. There are people around the country. I'm under the care of Queen Victoria Hospital in East Grinstead, who are fabulous. They are such a wonderful team and have really helped me so much. There's so much that can be done still. You know, you may get better, you may not, but there is definitely really effective treatment for it.
And there is that charity help out there. I know you wanted to mention that.
There is. Facial Palsy UK, it's a charity run and staffed by volunteers to inform, support and look after people with facial paralysis.
OK. Well, thank you both for coming in and telling your story today.
Thank you.
Thank you.
Good luck.
I'm very grateful.